Welcome to another episode from the Veterinary Research Channel. Today we're diving into a fascinating study that explores the surgical repair of urethral prolapse in dogs, a condition that can cause significant distress for our canine companions. Urethral prolapse is when the inner lining of the urethra, the tube that carries urine from the bladder, sticks out through the opening of the penis. This is most commonly seen in young, uncastrated male dogs, particularly those with pushed-in faces, like English bulldogs. While the exact cause isn't definitively known, it's thought to be related to a combination of factors, such as congenital abnormalities affecting the urethra, increased pressure in the abdomen due to breathing issues common in brachycephalic breeds, or even just excessive excitement. Affected dogs often show bleeding from the penis, excessive licking, and a noticeable purple mass at the tip of the penis. Because it does not occur very often, research is limited regarding the best surgical approaches, and recurrence rates can vary. Traditionally, two main surgical techniques have been used: resection and anastomosis, where the protruding tissue is removed and the urethra reconnected, and urethropexy, where the urethra is sutured to the surrounding tissues to prevent further prolapse. Some veterinary surgeons will combine both techniques. This study we are discussing today, which reviewed data from 2013 to 2023 across 3 animal hospitals, aimed to compare the outcomes of combined resection and anastomosis with urethropexy versus resection and anastomosis alone. The researchers hypothesized that the combined approach would result in lower recurrence rates. To conduct their research, the veterinary staff reviewed the medical records of 46 male dogs that met specific criteria, including complete medical records with surgery reports, information on short-term complications, and longer-term follow-ups. The dogs were divided into 3 groups based on the surgical technique used: resection and anastomosis alone, urethropexy alone, and combined resection and anastomosis with urethropexy. The researchers then analyzed the data to determine recurrence rates and identify any factors that might influence surgical outcomes. Here is what they found. Brachycephalic breeds were overrepresented in this study, accounting for 80% of the cases. English bulldogs were the most commonly affected breed. The median age of dogs at presentation was about 10 months, but brachycephalic breeds were typically younger than other breeds when diagnosed. Hemorrhage was the most common clinical sign. Now let's talk about the surgical techniques. In the resection and anastomosis procedure, the prolapsed urethra is removed and the remaining ends are sewn back together. The surgeons used sutures that would dissolve over time, in either a continuous or interrupted pattern. For the urethropexy, sutures were used to tack the urethra to surrounding tissues, with 3 to 5 sutures placed. The combined procedure involved both resection and anastomosis and urethropexy techniques. The results of the study revealed some important differences between the surgical approaches. The recurrence rate for resection and anastomosis alone was 48%, while the combined resection and anastomosis with urethropexy had a significantly lower recurrence rate of only 8%. Urethropexy on its own had a recurrence rate of 33%. This means that dogs undergoing the combined procedure were much less likely to experience a repeat prolapse. Interestingly, the combined resection and anastomosis with urethropexy group had a higher proportion of overweight dogs and were less likely to be operated on by experienced surgeons. Despite these factors, the combined approach still yielded better results, suggesting that it offers a significant advantage in preventing recurrence. Statistical analysis further supported these findings. Logistic regression analysis showed that performing resection and anastomosis alone was associated with a significantly increased risk of recurrence compared to the combined procedure. One possible explanation is that a combined procedure may remove damaged, redundant mucosa to lessen chronic shear forces and protect any remaining detached muscle layers, which gives them opportunity to adhere. There are some interesting points to consider as well. For example, the study touched on the role of castration. While being uncastrated is a known risk factor for urethral prolapse, the study found that dogs neutered before their initial diagnosis might be at a higher risk for postoperative recurrence. This might be because, in these dogs, other underlying risk factors were strong enough to cause the prolapse, even without the influence of sex hormones. The study also noted a significant age difference at the time of diagnosis between brachycephalic and non-brachycephalic breeds, which suggests there may be different underlying causes for urethral prolapse in these groups. Even though this study provides valuable insights into the management of urethral prolapse in dogs, there are some limitations to consider. The study's retrospective design means it relied on existing medical records, which may have lacked complete information. The sample size was relatively small, particularly for the urethropexy alone group, which limited the statistical comparisons that could be made. The study also relied on phone call follow-ups, introducing potential bias. In conclusion, this study suggests that a combined resection and anastomosis with urethropexy is more effective than resection and anastomosis alone in preventing recurrence of urethral prolapse in dogs. The findings support the consideration of a combined technique for surgical correction of urethral prolapse to decrease recurrence rates. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.